Canada's retirement income system. Your retirement and your income will typically come from three main sources. And these are the Canada Pension Plan, CPP, or the Quebec Pension Plan, if you're in Quebec, but you're not, and the Old Age Security. And of course, employer-sponsored pension plans and personal savings and investments. The Canada Pension Plan provides monthly payments to individuals who contributed to the plan during their working years. The amount you get every month depends on how long you've contributed to the plan and how much you've contributed. It also depends on the age when you start receiving your CPP. You can begin receiving your CPP at 60, but your amount will be significantly lower than if you begin at 65. You can hold on to your CPP and wait if you are working, and you may choose to take it as late as 70. Your monthly payments will be increased by the amount of time that you wait. And significantly, if you take it at 65 versus 60, there's a significant increase in the amount of money that you will receive from the Canadian Pension Plan. The Canadian Pension Plan requires that you have been living in the country for 10 years after the age of 18, and there's an equation for you to receive your full amount of CPP. And I believe that is that you have to have lived in the country for 40 years after the age of 18, lived and worked in the country for 40 years after the age of 18. And this, I think it needs to be consecutively. But on the website, which we sent a link to, and there's going to be links attached to this, there is an explanation of the amounts and the length of time having lived in the country. So when you go to the website, you'll see an option to apply online or to submit a paper application. If you are able to sign up for a My Service Canada account, it is beneficial. You can see when your payments are coming, you can see what you're eligible for. If you are missing a payment, there will be an explanation as to why, and if the government sends you any letters, they will also post them on your My Service Canada account page, and there you'll be able to take a look at these. There's also, if you apply through a paper application, you're also eligible to do that. That is a good way of, if you require services from me, if you require any help from anybody when you're applying for any social services, having a paper application is always helpful because I can look at it, or another social service worker or social worker can look at it and help you complete the process. If you would like to apply for My Service Canada account, you can always call Service Canada and they can walk you through it, or you can call me. There is an availability on the website to allow someone to work on your behalf. And so I could then potentially be of service. So Old Age Security is another portion of a monthly benefit that you can be eligible for. This is a monthly benefit who is paid to seniors who are 65 years and older. There's no employment history required for OAS. But if you would like to apply for the OAS, you should have resided in Canada for 40 years or more. When you receive an OAS application along with your CPP application, you will be eligible for a guaranteed income supplement. This is attached to your OAS application, and you will fill it out, and if you are eligible, then it will be automatically added to your old age disability pension. There's also Gains. Gains is a monthly income amount that ranges between $2.50 and $83. If you are eligible for guaranteed income supplement and you do not have any private income, then you will receive the maximum benefit every month. And this will add to the amount that you are eligible for. Guaranteed income levels for from July 1st, 2021 to September 30th, 2021, they've recently increased. They are now $1,645 a month, or $19,742 annually for single people, and $1,272 a month for qualified couples, if you are both receiving the OAS, CPP, and the Guaranteed Income Supplement. So now we're going to talk about some things that you may be eligible for moving into retirement. There may be things that you are concerned about, especially if you are somebody who is low income. If you are receiving ODSP and you have some coverage, there will be a cessation to the coverage that you're receiving, so it will end when you turn 65 and begin receiving CPP and OAS. So I would encourage you that if you are receiving ODSP right now, that you take advantage of all benefits that you are eligible for prior to turning 65. Go to the dentist, go to the doctor, go to your eye exams, request anything that you can be requested prior to your movement away from ODSP. I would say get it done now. I can help you if you have any questions about what you're eligible for. I have done a workshop on this, but I can let you know individually if it's necessary, if you are looking for specific services or how to access these services before you are on CPP or OAS, before you rely upon those to cover some funding. So for dental care, there is the Ontario Seniors Dental Care Program. The annual net income for an individual to be eligible for this is $19,000. This amount has increased as of July, and I believe it's now $22,000 a year. If you have no other form of dental benefits, including private insurance or any other coverages, whether it's the Ontario Disability Support Program or Ontario Works, then you would be eligible for the OSDCP, which is a dental program that will cover the majority of your dental care. There is a place in London, Ontario called the Wright Clinic, and I will link that. The Wright Clinic is a wonderful place that provides low-cost dental care. The dental care is exceptional, and it is, you can get things like a root canal. The root canals, I think that the maximum they charge is like $135. Something that is generally out of reach for most of us. Root canals can be upwards of $2,000. They are, I'm doing them for a cost that is, can be, achieved. Their basic dental care is about $30 per visit. And if you are eligible for an OSDCP, it's Ontario Seniors Dental Program, then you are eligible to receive care from the Wright Clinic. But you do not have to be eligible. Let me just say this. You do not have to be eligible for the OSDCP in order to go to the Wright Clinic. You can be a recipient of OW or ODSP, and you can just be a low-income individual who has not yet applied for an OSDCP. And you can still, if you receive a GIS, a Guaranteed Income Supplement, then you can apply to the Wright Clinic as well. And they're wonderful. So for prescription coverage, there's the Ontario Drug Benefit Plan. And this is something that you will be enrolled in automatically when you turn 65. I believe, and I think that they send you a form. But if they do not, then they automatically enroll you. And if they do not automatically enroll you and you have not received a form, then you can request one. If you find that you are paying for your prescription drugs, then this is a very simple form to fill out. I can help fill this kind of form out. And it will allow you to pay only a very small amount. I think it's $2 per prescription. And you will not be charged for your full prescription. They cover a wide variety of prescriptions. The Ontario Drug Benefit Plan also covers diabetic requirements, so needles, testing strips, things like that. There's an exceptional access program too, and where you may also be able to request different prescription drugs. Also, some over-the-counter drugs may be covered, like ibuprofen, acetaminophen, Tylenol, things like that. Things that you would require but aren't necessarily a prescription drug. You can be given some pre-approval to go to the pharmacy and get those covered by your Ontario Drug Benefit Plan. ODB, the Ontario Drug Benefit Plan for those over the low income cutoff. So if you're a single senior or you are a couple and you're making more than the $22,200 cutoff, which sometimes happens, and it can be even marginal, you know, like you could be making $23,000 or $23,000 a year, or, you know, so you're still low income essentially, but you're not low income enough to apply for the Ontario Drug Benefit Program. You could apply for the co-payment, and the co-pay means that you will have to pay $100. I think that the amount is $100 initially. That's your copay, and then it's about $6.11 for each prescription. And so it is still a reasonable amount, and it will cover the cost of the majority of your prescriptions. If you would like to do this, if this is something that you would like to apply for, there is a form that I will link, and you will fill it out and explain, you know, the cost of your medication and the costs of your, and your income level, and they will examine this and then give you an amount for copay. The Assistive Devices Program. The Assistive Devices Program is a program that will pay up to 75% of any equipment that you need. Wheelchairs, hearing aids, diabetic equipment and supplies, home oxygen therapy, prosthetics, ostomy supplies. There is a list on the website of things that you are eligible for. It can get a little bit confusing because there's also a list of things that you're not eligible for, and they seem to overlap, and I had to read it a few times. But I can help you navigate this. If you are looking for a mobility aid of some kind, or any other sort of devices that are required for someone who has a long-term disability, then I can help you navigate what is available to you and what isn't available to you. You will also want to find out who is available to prescribe these equipment for you. So you'll have to see, oftentimes a doctor will see you prior to you applying for an assistive devices program, and they will be able to point you in the right direction as to what you need and to give you that referral. Sometimes you have to pair up with a doctor that is specialized to help you, to refer you to these programs. And so they have a list of doctors as well. I believe that's for the Ontario Drug Benefit Program as well, that if you require specific prescription drugs, depending on what your particular issue is, then they will have to pair you up with an individual that may be a prescribing doctor for these medications. These are two other places that you can look. The Farley Foundation, this helps seniors who require help with feeding their animals or taking care of their animals. They help with funding for low-income seniors who would still like to keep their animals in their home and keep them healthy and take them to the vet. And then this is a link to a toolkit which gives you a good rundown of how to apply for old age security programs. This is our information. We have another workshop coming up in September on an ID clinic. This is going to be provided by me along with a co-host from the London Community Health Center on how to access your identification if you are lacking or have limited identification. If you have any other questions, you can contact us here. And I am best contacted by email, life@execulink.com. Also on our website, there is a form which will allow you to contact me directly and explain what kind of help you need. Thanks so much.